Hello, and thanks for joining me. In the next few minutes, I'll introduce you to the VSP Patient Record Report, commonly known as the VSP Authorization. This module will cover how to access a patient's authorization on Eyefinity.com and use the information to better understand patient eligibility and benefit coverage. For information on how to issue the authorization or calculate patient out-of-pocket costs, please call VSP at 800-615-1883. Let's get started. Using an authorization number, you can access the patient record report through Eyefinity.com. Click Get Authorizations and check eligibility. Select Reports in the Select Starting Page section. Enter the 8-digit authorization number and click Go. Let's start at the top under Patient Identification. You'll see the patient's name, polycarbonate, relationship to the main policyholder, and ID number. It's important to double-check this section to make sure you have an authorization for the correct patient. On the right are the authorization number and effective dates. You can see that this authorization is valid for 1 month. The date of service must be before the expiration date, and there can only be one date of service per claim. If the authorization is expired or you need to submit multiple dates of service, you'll need to get a new authorization. Eye health management conditions and patient history information are also available for your reference on a separate tab. This way, the doctor is aware of any conditions that have been identified by the patient or at a previous VSP doctor visit. As a VSP network doctor, accurately reporting certain patient conditions to VSP is your responsibility. By reporting health conditions to VSP, you help connect your patients to wellness programs that can help aid them in managing their overall health and wellness. Ensure the person in your office who submits claims to VSP knows of any conditions the patient may have. You can select the appropriate patient condition boxes right on the patient record report. When the Well Vision exam claim is submitted, you'll check the appropriate condition boxes in each claim. Now, let's take a look at the patient coverage section. The top row shows Paul's eligibility. The yes indicates that he is eligible for that service. If a date is indicated, this means that he's not currently eligible, but will be on the date listed. An important tip regarding contacts is that even if the authorization says yes all the way across, Paul's only eligible for an exam in glasses or contacts, not both. Just below that is service frequency, which shows how often benefits are available and the month services begin. Patients can have one of 3 types of service frequencies. Service, which means that the patient's eligibility resets on the first of the month based on when the patient last received services. Calendar year, which means that the patient's eligibility resets in January. Or fiscal year, which means that the patient's eligibility resets in the month set by the employer, like July. In this example, Paul has a calendar year frequency and is eligible for his exam and lenses every 12 months, and a frame every 24 months. As we discussed, the patient can get either spectacle lenses and a frame or contacts. If he uses his benefits for contacts, that will use up his eligibility for both spectacle lenses and frames. Let's look at a couple of different scenarios for Paul. In our first scenario, Paul gets glasses in January of 2019. He'll be eligible for lenses again on January 1st, 2020, and for a new frame January 1st, 2021. Since he can't use his benefit for both glasses and contacts, he won't be eligible for contacts until January 1, 2020. But what if Paul wants to use his coverage for contacts instead of glasses? In another example, Paul uses his VSP benefits for contacts in March of 2019. He'll be eligible for either spectacle lenses or contacts on January 1st, 2020, but won't be eligible for a frame again until January 1st, 2021. Below the eligibility and service frequency, you'll see the patient's plan and a reminder of any lab requirements. There will also be a call-out for other benefits that patient may have, such as coverage for low vision or retinal screenings. All VSP Signature Plan, VSP Choice Plan, and VSP Advantage Plan patients are eligible for retinal screenings as a value-added benefit, unless it is noted that they have a covered benefit for retinal screenings. You can learn more about retinal screenings in the Provider Reference Manual at VSP Online under Plans and Coverages. The next section is Plan Details, and the first line is the patient's copay. This will indicate if the patient has a copay, and if so, what kind of copay it is. For questions about copays and how they work, please call us at 1-800-615-1883 or refer to the VSP manuals. In this example, Paul has a $10 exam copay and a $25 materials copay. Right below copay is the patient's wholesale and retail frame allowances. You'll use these to determine if the frame is covered for the patient, or if not, what to charge them. Wholesale frame allowance is abbreviated WFA. You'll also notice the patient has higher frame allowances when they choose Marchand or Altair frames. Check out the VSP Global Premier program to learn more about how this patient benefit can help you attract and retain more VSP patients and earn a host of exclusive benefits for your practice. Next is the contact lens benefit. In our example, Paul has an exam and plan, and the coverage details are explained in this section. Below that, you may see notes or reminders, including information about necessary contact lenses or additional plan details. Criteria applies means that the patient needs to meet special eligibility criteria in order to have the item covered, or there is a unique element to that item in the patient's plan design. Whenever you see items in this category, refer to the VSP manual for more information. The Value-Added Discounts section lists discounts that apply to services received in addition to the member's covered benefits. Lens enhancement details will help you determine the patient's coverage for lens enhancements. You'll notice that there aren't any brands here, just categories of lenses and options. Any lens enhancements listed in the covered section are covered in full, which includes any brand available through the VSP Contract Lab system. The next section is covered with additional copay, which means that the patient can add on the enhancement but is responsible for the cost. The patient's cost for enhancement will vary depending on what type of plan they have. Refer to the VSP manual for more information about what to charge patients for lens enhancements. Any item listed in the Not Covered section can't be included on a VSP claim. If included, VSP will deny both the lens and frame portion of the claim, and the patient will be responsible for the entire cost of the glasses as a private transaction with your practice. That's it. Now you know how to read the patient record report.